Hi friends, welcome you all. So in our previous lecture we have seen basic anatomy as well as physiology of respiratory tract, and in that we have covered several infections. So here from in this lecture we will study remaining bacterial infections of lower respiratory tract. In that bacterial pneumonia is there, chlamydial pneumonia is there, mycoplasma pneumonia is there, then tuberculosis, pertussis, then inhalation anthrax, then Legionella pneumonia, that is called as Legionnaires disease, as well as Q fever and PSITTACOSIS. Okay. So first, bacterial pneumonia. So one of the most serious lower respiratory tract infection, bacterial pneumonia can be divided into two types, that is nosocomial as well as community acquired. So nosocomial means this is a hospital borne infection, and community acquired means it is acquired through community transfer methods. Each type can be caused by a variety of organisms. In that nosocomial pneumonia occurs approximately 48 hours after admission to hospital, then usually associated with Staphylococcus aureus and also caused by gram-negative bacteria, particularly difficult to deal with if the pathogen is resistant to antibiotic. So nosocomial pneumonia means nosocomial infections we get after these are actually hospital borne infection, and hospitals we know that there are it is where all patients of different kinds of disease they are treated. So obviously it is a reservoir of many diseases if not proper hygienic condition is not maintained. Nosocomial infections they are prevalent. And second, in community acquired pneumonia usually present as a lobar pneumonia and accompanied by fever, then chest pain as well as production of purulent spectrum. So community acquired pneumonia usually occurs after aspiration of pathogen and require enough pathogen to overwhelm resident defenses. So establishment of an infection in the lungs depends upon the number of pathogens entering and competence of mucociliary escalator. Okay. So classical lobar pneumonia has four stages. First is acute congestion, then red hepatization, then grey hepatization as well as resolution. So first, acute congestion, it involves local capillaries become enlarged with neutrophils. Then in red hepatization, so red blood cells from capillaries flow into alveolar spaces, and in case of grey hepatization, large number of dead neutrophils are the first immune cells that are reached to the site of infection through process known as chemotaxis and degeneration of red cells. So large number of dead neutrophils they aggregate, they form grey hepatization condition. In case of resolution, adaptive immune responses begins to produce antibodies. So these are four stages of lobar pneumonia. Then bacterial pneumonia is there are two types. The atypical pneumonia in which coughing without sputum then and is caused by a variety of bacteria, and in case of bacterial pneumonia can progress into production of lung abscess. So in second type, a typical or classic pneumonia, a typical bacterial pneumonia is a respiratory condition with inflammation of lung. So pneumonia is related to, in this second type, lungs they get inflamed, they get swell, and often characterized as inflammation of parenchyma of lung, that alveoli, and abnormal alveolar filling with fluid, pneumococcal fluid that is we call. And the typical symptoms associated with pneumonia include cough, chest pain as well as fever and difficulty in breathing. And in case of bacterial pneumonia, it is treated with antibiotics. Then further classification of pneumonia is concerned. So it is a lobar pneumonia that is caused by Streptococcus pneumonia that affects a part of lobe in the lungs, or it may affect more than one lobes. That's why it is known as lobar pneumonia. And bronchial pneumonia. So pneumonia spreads to several patches in one or both lungs, and it is most prevalent in infants, young children as well as aged adults. And cough with or without mucus, then chest pain, then rapid breathing and shortness of breath. These are common symptoms, and it is mostly transmitted by respiratory droplets. So there are types of bacteria causing pneumonia. It includes gram-positive bacteria. In that, Streptococcus pneumonia is there. Again, it is often called as pneumococcus or Staphylococcus aureus, with Streptococcus agalactica. Then, in case of gram-negative bacteria, it is caused by Haemophilus influenzae, Klebsiella pneumoniae, and Escherichia coli, as well as Pseudomonas aeruginosa and Moraxella catarrhalis. So pneumonia is basically inflammation of lung, and it might be due to these kind of bacteria. It may be gram positive as well as gram negative, and besides lung swelling, it accumulates fluid in lungs. Okay. So in case of treatment, the course of treatment depends upon the severity of infection as well as type of organism causing infection. So most common pathogen is Streptococcus pneumoniae, and it is treated with penicillium as well as amoxicillin, clavulanate as well as erythromycin. So these are choice of drug for treating Streptococcus pneumoniae. Then in case of chlamydial pneumonia, it is caused by Chlamydia pneumoniae and found throughout the world. It is responsible for 10% of pneumonia cases of pharyngitis and lower respiratory tract infection. Infection occurs throughout the year and it spread by person to person contact, and more infections is seen in elderly persons, and it can cause both community acquired as well as nosocomial infections, and it is similar to Mycoplasma pneumoniae, and tetracycline or erythromycin, they are the choice of drug for treatment of this chlamydial pneumonia. Then Mycoplasma pneumonia, it is a mild form of pneumonia, accounts for about 10% of all pneumonias, and referred to as a walking pneumonia, and there is no need for hospitalization, and most common age for infections it is between 5 to 15 years, and it causes approximately 30% of all teenage pneumonias. Then in case of Mycoplasma pneumonia, is caused by Mycoplasma pneumoniae, and it lacks a cell wall, acquired by droplet transmission. Infections dose fewer than 100 pathogens and found throughout the world, especially in temperate climate, and infection may affect trachea as well as bronchi as well as bronchioles, and may extend down to alveoli. So fever, headache, malaise for 2 to 4 days, then mild tracheobronchitis, then fever, cough, headache and malaise, sore throat, otis media. These are the clinical complications associated with this Mycoplasma pneumonia. And in case of treatment, erythromycin and tetracycline, they are the choice of drug to treat this kind of infection. Tuberculosis, again it is the most important bacterial diseases of lungs, and estimated 1.7 billion people are infected and 3 million die each year. These figures they may vary year to year, and again depends upon different kinds of age group as well as various regions. So AIDS and HIV infections have had significant role in increasing tuberculosis. So mostly this disease is manifested in immunocompromised patients, especially in cases of AIDS as well as HIV. This is the secondary clinical complications in tuberculosis, and it is mostly seen in poverty as well as poorly socioeconomic conditions. We can say that this is the disease of poor people who are working in unhygienic conditions and are breeding ground for these are poverty as well as poor socioeconomic conditions are a breeding ground for tuberculosis. So drug resistance is becoming increasingly dangerous. So there are several strains of tuberculosis bacteria. They are resistant to various kinds of antibiotics, and this antibiotic resistance is new strains. They are emerging as a multi-drug resistance antibiotic strains of tuberculosis bacilli, and this is a problematic situation as far as this disease is concerned. So there are very few antibiotic they are effective, and in case of treatment of tuberculosis, we have to treat the patient for a longer period, for up to 3 months or up to 6 months. Again, it is depend upon the which type of the patient in which type of mode of infection. So the major reason for resistance is non-compliance, and many patients stop for taking drugs early. So early detection is vital, and initial symptoms are similar to those seen in other respiratory infections, and it is important to look for fever, fatigue, weight loss. So these are main symptoms associated with tuberculosis. So shortness of breath, then congestion with coughing, and main symptom is night fever as well as fatigue and weight loss. It is caused by Mycobacterium tuberculosis. It is again actinomycetes, and it is a rod shaped bacillus. It has acid fastness, and it is non-spore forming and produces mycolic acid. This is the main property. It is waxy material, and this waxy material resists for various drugs, means their action, and makes it difficult for gram staining, and protects pathogen from antibiotic therapy as well as host defenses. So Mycobacterium tuberculosis cell wall interferes with macrophage function and white blood cells, which acts as a phagocytes and immune cells activation, and inhibits the formation of phagolysosome. A phagosome is a vacuole formed around a particle absorbed by phagocytosis, and a lysosome are cellular organelles which contain acid hydrolase enzyme to break up waste material in cellular debris. So inhibits the formation of phagolysosome. So this particular bacteria, that is Mycobacterium tuberculosis, it resists for normal phagocytosis process, and phagolysosome formation is the normal step in the process of phagocytosis, and this the step is resisted by this kind of bacteria. So this allows Mycobacterium tuberculosis to escape into cytoplasma, where it increases number and eventually spreads through lymph nodes. So from here it enters into the blood and distributed throughout the body. So in this X-ray photograph, you can see patches of different tuberculosis disease, and two basic types of tuberculosis are there. Is primary as well as secondary, and primary, in case of primary, follows initial exposure to pathogen, and secondary can occurs after a year later. So in this X-ray patch, you can see the dark color of black color patches of tuberculosis. So it occurs when host encounters pathogen for first time. In case of primary tuberculosis, an organism find their way into alveoli, and a localized inflammatory response get developed, and phagocytosis occur bacilli by macrophages. So these are the primary tuberculosis details. Then pathogens, they are not killed, they are engulfed, but they are not killed, and they resides in macrophages, and they are transported by white blood cells to original lymph nodes, and they continue to divide intracellularly, and cell mediated immune response begins, and if the primary lesion is not contained in tubercle form. So tubercles are aggregates of enlarged macrophages filled with bacteria. So you can see readily in X-rays. Then secondary tuberculosis, in case of its pathogenesis. So secondary tuberculosis can be due to reactive or lesions and gradual progression of primary tuberculosis into chronic diseases. So reoccurrence of disease occurs in small percentage of patients, and it usually manifests itself in the apices of lungs, and usually occurs within 2 years of primary infection, and it can evolve decades later when innate resistance is diminished. So this secondary tuberculosis, it takes several time, and still this bacteria resides in your body. So in case of treatment, it is usually a tripole therapy containing isoniazid drug, then pyrisoniazid drug, then rifamycin. So these drugs, they are used in cocktail or in triplet. So triple therapy, this therapy is known as triple therapy, where 3 different kinds of drugs they are used, and all these are taken once a day for 2 months, and INHP and RFE also taken for 9 or more months. Okay. So if the patient is drug resistant, the initial treatment includes ethambutol. So this is again different approach for treatment, and compliance with drug therapy is very important, and compliance can be difficult because side effects, the drugs are very toxic and more serious in a lower liver toxicity. The next important disease is pertussis, that is commonly known as whooping cough, and it is spread by airborne droplets from patients in the early stages, and it is highly contagious, and it infects 100 to 80 to 100% of exposed susceptible individuals, and it spread rapidly in schools as well as hospitals, offices and homes because of crowded places and just about anywhere. So this caused by Bordetella pertussis, and it is a gram negative coccobacillus. It does not survive in environment, and it is a reservoir in humans, and symptoms can be similar to those of cold, and infected adults often spread the infections to schools as well as nurseries. So mortality is highest in infants and children under 1 year old, and immunization against pertussis is started in the 1940s. So continuous today as a part of DTaP vaccination, and pertussis appears to be making comeback, and epidemics are occurring every 3 to 5 years, and greatest number of infections are among we can see in 10 to 20-year-old people who are not immunized, and shows relationship between lack of vaccination and infection. So Bordetella pertussis has affinity for ciliated bronchial epithelium, and after attaching it produces tracheal toxin and immobilizes and progressively destroys the ciliated cells. So this toxin is basically involves in destruction of ciliated cells and causes persistent coughing, and is caused by inability to move the mucus that builds up, and pertussis does not invade cells of respiratory tract or deeper tissues. So in case of pertussis, the incubation period is 7 to 10 days, and infection has 3 stages. So it persistent perfuse and mucoid rhinorrhea, that is runny nose, and first stage it is you can see by diagnosing runny nose, and many have sneezing, malaise as well as anorexia, and most communicable during this. So this is the most communicable stage as far as others are concerned, and complication of pertussis can lead to superinfection with Streptococcus pneumonia. So most common complication of pertussis, they are superinfection with Streptococcus pneumonia, then convulsions and subconjunctival as well as cerebral bleeding as well as anoxia. In case of treatment, so antibiotic can be used in early stages, and it limits the spread of infection, and once the paroxysmal stage is reached, the therapy is only supportive, but vaccination is the best option to prevent pertussis. Then next disease is inhalation anthrax. So it produces fulminant pneumonia, and it comes on suddenly with great severity. It leads to respiratory failure as well as death, and anthrax primarily a disease of herbivory acquired from spores found in pastures, and its spores are inhaled. Anthrax can occur in the respiratory tract. So anthrax is again many respiratory disease, and it is caused by Bacillus anthracis, and infection is infrequently seen in healthy individuals, usually present as a localized relation where it occurs, and has been a recent interest in the inhalation anthrax as a biological weapon. So in October 2001, letters contaminated with powdered anthrax spores were mailed to various locations in US, and this is the main incidence in case of anthrax, and several deaths are resulted due to this activity. And the causative agent is Bacillus anthracis. It is gram positive role, and it does not form any kind of spores, and spores germinate in human tissues. It is spore forming bacilli, and spores germinate in human tissues, and antiphagocytic properties of the capsule aid its survival as well as growth in large number. So it produces capsule, and this capsule resists for normal phagocytosis, and this is the main defending mechanism for this Bacillus anthracis. In case of pathogenesis concerned, so pathogenesis results from powerful exotoxin produced, and symptoms of pulmonary anthrax are 1 to 5 days of non-specific malaise as well as mild fever, then a non-productive cough as well as progressive respiratory distress and cyanosis, and a rapid and massive spread to central nervous system and bloodstream is followed by death, and antibiotic therapy can be successful. So Bacillus anthracis is susceptible to penicillin, and doxycycline and ciprofloxacin are the alternative prophylactic measures we can use, or these are the choice of drugs that can be used to treat this kind of infections. The next disease is Legionella pneumonia, it is Legionnaires disease, and it is caused by Legionella pneumonia, pneumophila, and it is gram-negative rod. It cannot be stained or grown using normal techniques, and it transmitted to human as a humidified aerosol and not by person to person contact. So Legionella is ubiquitous. It is present in fresh water, and erythromycin is better choice to treat this drug than penicillin. Then Q fever, it is caused by Coxiella burnetii, and this infection we get from consumption of raw milk. So it is a zoonotic infection see worldwide, and it is mostly seen in cattle as well as sheep as well as goats. They are the primary reservoirs for this disease causing agent, and it is caused by Coxiella burnetii. It is gram negative spore forming grow well in placenta of animals, and a large number of Coxiella can be transmitted by inhalation of during the animal births. So transmission can also be by ingestion of unpasteurized milk, and most cases resolve spontaneously. So tetracycline is a choice of drug for use of treatment, and it can be shorten the fever. And in case of pathogenesis, it is still not clearly understood. So it begins after 9 to 20 days after inhalation, and abrupt onsets of chills, fever and headache we can see, and it can also mild headache, mild hacking cough as well as patchy intestinal pneumonia can be seen, and some cases show abdominal liver function. Then cytocosis or ornithosis is again zoonotic pneumonia and contracted by inhibition of bird droppings infected with chlamydia cytokine, and it is found in many birds including turkeys, and some strains of chlamydia cytokine are extremely contagious. Its symptoms include acute onset of fever, headache, then malaise as well as muscle ache, and dry hacking cough as well as bilateral pneumonia. So tetracycline and erythromycin, they are the choice of drug to use this infection. Then in case of viral infections of the lower respiratory tract, so 75 to 80% of all acute respiratory tract infections in most of the country, they are caused by viruses, and the incidences vary with different age groups, and it can be seen in young age group also. So majority of acute viral infections are in the lower respiratory tract, and it is caused by influenza viruses. Again, it is the common respiratory illness, and respiratory syncytial viruses. So common characteristics are short incubation period, it is for 1 to 4 days, and transmission from person to person, and it can direct transfer through droplets as well as indirect through transfer of contaminated secretions. So in that first influenza, it is a virus known as orthomaxovirus. It is belongs to influenza virus is an orthomaxovirus group that belongs to this orthomaxovirus group, and virions are surrounded by envelope. Genome is single stranded RNA, and it allows high rate of mutation. So three major serotypes can be seen in this viruses. They are A, B, C, and differences based on antigenic properties associated with this nucleoprotein. Here in this picture you can see structure of influenza virus. So it has different spikes as well as lipid layer. So influenza is a significant health concern. So human virus can combine with an avian virus to produce highly pathogenic viruses. Humans are the host for influenza, and aquatic birds are the reservoir. In case of a primary manifestation of infection is severe respiratory problems, and outbreaks have been described since 16th century. So differ in severity nearly every year and occur more frequently in the winter. So direct droplet transmission is mostly found common method of spreading, and a major outbreak occurs every 2 to 3 years, and typical epidemic lasts for 3 to 6 weeks, and up to 10% of general population is affected, and illness rates exceeded 30% in certain groups. So it is mostly found in school age children as well as a resident of closed institution. So influenza virus prefers the respiratory epithelium, that is viremia. and viremia is rare. So viruses multiplies in the ciliated cells of lower respiratory tract, results in functional as well as structural abnormalities, and cellular synthesis of nucleic acid as well as protein is shut down, and ciliated mucus producing epithelial cells are shed. So substantial interference with clearance mechanism and localized inflammation we can see. And there are 3 bacteria that are common cause of superinfection, includes Streptococcus pneumoniae as well as Haemophilus influenzae and Staphylococcus aureus. So these are superinfection means these bacterial infection may occur along with normal influenza infection. So in case of treatment, so there are 2 basic approaches. So symptomatic care as well as anticipation of potential complications. So the best treatment are rest as well as fluid intake, and conservative use of analgesics for myalgia as well as headache and cough suppressant. So there is no antiviral drug that is used against this treatment, and amantadine and rimonabantadine are useful only if the infection is diagnosed within 12 to 24 hours. Then fungal infections of respiratory system. The major factors govern the incidences and spread of fungal infections. They are ubiquity of infectious organism. So fungi, as we know, they are ubiquitous. They are found in soil as well as they are resident flora. They are part of normal flora of our body, and in case of adaptive immune response, usually keeps these infections under control, and immunocompromised patients, they are much greater risk by this fungal infection, and in that first is pneumocystis, pneumonia. It is caused by pneumocystis carini species, and it is common in AIDS patients, those are immunocompromised patients, and it is lethal pneumonia. So it is never been grown in culture, and most information comes from clinical information from patients. So this is the severe fungal infection, and it is caused by pneumocystis pneumonia, that is PCP, and it is mostly found in HIV patient. Then blastomycosis, it is caused by blastomycosis dermatitis. Spores of fungi enter through the respiratory system and primarily affect the lungs, and can spread through bloodstream and affects other parts. So males between age of 20 and 40 years are the most commonly infected, and blastomycosis is increased in AIDS. So infection in lungs, symptom includes fever, chills as well as drenching sweats develop, chest pain, then difficulty in breathing, and cough may also develop and can sometimes heal without treatment, and skin will see warty patches develop surrounded by tiny painless abscesses, and bones, painful swelling can be found in bones, and genital urinary tract in case prostatitis or painful swelling of epididymis can be seen in case of a blastomycosis. Then next is HISTOPLASMOSIS. It is caused by Histoplasma capsulatum and occurs in soil contaminated with bat as well as bird droppings, and it is commonly found in temperate, subtropical as well as tropical zones, and 50 to 90% of residents in these areas test positive for exposure. So people who live and work in the vicinity of bat or birds dropping are increased risk of this infection, and amphotericin B is the choice of treatment for this clinical complication. So in case of transmission, it is transmitted through inhalation of conidia, so small enough to reach bronchioles as well as alveoli, and intravenous amphotericin B or oral B intracoasal can be used. So after inhalation, microconidia converts to yeast form, and these are phagocytosed tubercle forms, and severe cases may develop chills as well as malaise, chest pain, and extensive pulmonary infiltration. Then coccidioidomycosis, it is caused by coccidioides immitis, and infection can be symptomatic or asymptomatic, and symptoms can known as valley fever, and it is restricted to certain geographical areas. So Arthropodia are the fungus. They are after inhalation of these fungus, this disease get manifested. So fungal outer wall has antiphagocytic properties, and it prevents the elimination of this fungi from our body, and Arthrochonidia, they convert to spirules which grows slowly, so complete inhibit phagocytosis. So these structures, they inhibit the process of phagocytosis. So in case of disseminated it is mostly seen in HIV patients and can also cause from meningitis. Okay. So it is usually self-limiting and no treatment is required, and progressive pulmonary infection or infection of central nervous system, it is treated with amphotericin B. Then aspergillosis, it is again important fungal infection and it is invasive aspergillosis. It can show rapid progression to death and typically seen in immunocompromised person, that is person who are suffering with AIDS or cancer, and also seen in individuals with pre-existing pulmonary diseases. So it is chronic bronchitis, asthma or tuberculosis, and fungus produces extracellular proteases as well as phospholipases and toxic metabolites. So it is caused by fungus aspergillus and it is widely distributed throughout the world, and dispersal of these aspergillosis occurs through inhalation of resistance conidia, and it can be seen more and more in nosocomial infections associated with air conditioning systems. And in case of pathogenesis, so colonization with aspergillosis leads to invasion of tissues, and it invades the lungs tissues and causes penetration of blood vessels, and this causes hemoptysis and acute pneumonia, and pneumonia is accompanied by multifocal pulmonary infiltration of high fever and progenesis in graves. Then mortality for an invasive aspergillosis is 100%, and amphotericin B is the choice of drug, and itraconazole, it can also be used for treatment of this aspergillosis disease. So here we have studied in detail different infections of respiratory tract, and in next lecture we will see diseases related to another system. Thanks.